There's a 15-second delay. Good morning, everybody. I'm absolutely delighted to invite Amy Walsh to tell her CVST story. I would like to give a warm welcome to Amy. She's a brave fighter and a lovely, warm and kind human being with a special talent for writing poetry and songs. Amy has been an amazing patient advocate, sharing her experience and supporting others, while also helping Thrombosis Ireland fundraise in the mini marathon and in our present lockdown challenge. Why don't you join her? Click on the link, everybody. In 2017, at 24 years old, Amy was on holiday in Wexford when she developed a bacterial infection in the side of her face. Here, her blood clot story began. There you go, Amy.
Thank you. Yeah, so that is actually when it happened. I wasn't diagnosed until July 2018, but yeah, it was a long road. So I remember I was on holidays in Wexford in 2017 with my family. I had a toothache in my mouth, and I was kind of saying, it's nothing to worry about. I was away for 3 days, so on Friday I was okay. On Saturday I was taking Vimova and paracetamol like sweets. I just couldn't cope with the pain in my face. It was the whole way down my face, on my neck, and then by the Sunday I had no voice. So yeah, I went to the on-call doctor then that day, and he gave me steroids and antibiotics, but I had a bacterial infection all down my face, all laryngitis everywhere. It started with this lump. I thought it was inflammation on the side of my face, and I will come back to that a few times because it's the basis of the story. But yeah, so it was the lump that kind of made me go and see the doctor in the first place, because I was worried that something was actually really wrong. So I went to the dentist then a few weeks later, and just to get a checkup to see if this was a dental issue. She told me, no, it's nothing to do with teeth at all. It's muscle. It's nothing to do with anything in the mouth. So that was fine. I knew then that I had to go see the doctor about it. Like, even though it wasn't sore, I knew that it wasn't normal. And at the time it was only small enough, so it was just something that was starting to annoy me, the fact that it was there and I could see it in the mirror. And so I went to the doctor, and she told me that I had a salivary gland infection. That was fine. I went home, I took antibiotics for a week. They didn't really make any difference to me, obviously, because there was no pain. So I went back then about 2 weeks later, and she diagnosed me with a salivary gland infection again. So she put me on different antibiotics and told me to take them for 10 days this time. Again, it made no difference because there was no pain, there was nothing changing, no inflammation going down or anything like that. So I went back again, and at this stage I had a pep talk from my mum, who was saying, like, you need to go get it checked, and if they're not listening to you, you need to make them listen to you. So I went into the doctor then, and it was the same woman again, and she told me that it was what is the word? An adamant salivary gland infection that wasn't going away. I told her there was no pain in it, so she had to feel around. She was none the wiser. She was going to give me antibiotics again for a salivary gland infection, so I actually just sat there and I said, look, I need somebody to take me seriously here. I was like, it's not painful, but it is abnormal, and I just wanted to get it sorted and fixed. So she called in the doctor from the practice, and he came in and he had a feel of my mouth and inside my mouth, and his analysis was she needs to be sent for an ultrasound, straight away, like, get this done as quick as possible. So that was in December, I think, in 2017, that I was finally taken seriously. And then my ultrasound came up in February. So on the 22nd of February, I think it was, if my memory serves me well, the 22nd of February, I had my ultrasound on my face, and he had a look at everything. He had no answers for why the lump was there. He couldn't understand it at all. He sent me for bloods because I had a slightly enlarged thyroid here, I think somewhere here. But he said it wasn't concerning, he just needed to check calcium levels, so that was fine. Because he wasn't sure what the lump was, he sent me for a CT scan. He said it would take a while, but it needed to be done because there was no reason for the lump being there that he could see. So that was fine. I remember then in March I was struck down with Aussie flu. I was really sick. I kept having small instances of being, you know, really sick. Like I had Aussie flu and I was taken to hospital in an ambulance in April for a kidney infection.
So really, this is like 6 months later, Amy.
Yeah.
So from the very first time. My God. Okay.
It was just getting like weird. My mom kept saying to me, you know, like why like all the hospital visits and, you know, even being taken in by ambulance for a kidney infection, it just wasn't normal. Right. Do you know what I mean? They couldn't find any reason. I had massive pains all up my side and they couldn't find any reason for me being there other than a slight kidney infection. So there was a few instances in between then that I was kind of like, right, something is wrong, you know. So in, I think it was May that I had my CT scan. And that was fine. It all went really well. I had the receptionist from the doctor call me back about the CT scan about a week later, I'd say it was, maybe 2. And she told me that it was a lipoma. And I wasn't sure what that was. So I asked her and she said, it's just a lump of fatty tissue. It's benign. It doesn't mean anything. So I was kind of, my initial reaction was, well, can you take it out? Like, can you take it away? Like, I don't want it here. Like,
yeah, was your face still very swollen?
It was getting bigger and bigger, and to the point that my friends were noticing, you know, this big lump on my face. So I asked her, could they remove it? And she laughed at me and she said, no, like we wouldn't remove something like that. I just wasn't aware what was going on. So that was fine. I just went on about my day just as normal. I was referred to an ENT from the ultrasound just to see if there was something going on anywhere else. So yeah, I went to see him then, I think at the start of June.
Okay.
And this is like nearly
a year on.
Yeah.
Yeah.
So I went to see him in June and he was fantastic. Like if it wasn't for him, like I wouldn't have been diagnosed. But basically he had a look and a feel and he said, you know, what were you told about the CT scan? And I was like, well, I was told that it was a lipoma. And he was just saying, like, he was feeling around and, you know, he was really looking confused. And then he was saying to himself, you know, I actually really don't think that this is a lipoma, Amy. I was saying to him, like, what do you think it is? Because he was starting to worry me at that stage. And he was like, I'm not sure. I've never felt anything like that before. Okay. He said, to me, it feels like, you know, muscular. And I said, right, okay, so what do we do next? And he was saying, you know, well, an MRI is the next step for me. Like I need to get in and see this more. I need to do a contrast MRI to see just from, I think it was from my nose down to the top of my chest that he did one. So that was fine. That was really done really quickly, actually. That came around in July, but he said that he wanted to do a biopsy as well on it. So I wasn't, you know, I wasn't saying no. I wanted it done and dealt with. Yeah, absolutely, yeah. But then on the 18th of July, I think it was, that I had my MRI, or the 17th, I can't remember, but it was, yeah, I was in the MRI for about an hour. I remember feeling so claustrophobic and so nervous, but I was so glad to have it over me and have it done. I felt like a medical anomaly at that stage. I didn't know what was going on. So yeah, that was really good. On the 20th, I think, of July then, 2 days later, I went grey and I had a headache that was like insane for the whole day of the 20th. Excuse me. I was in bed all day and I wasn't able to eat. I wasn't able to get up. I wasn't able to sit up. I was lying on my bed flat and I was sipping at water. There was nothing I could do. And I Googled, Google is not your friend, by the way. I Googled, you know, like, why do I have such a bad headache? And then I stumbled upon something that said you can get a bad headache after an MRI.
Okay.
So I was kind of like, oh, that's what it is. Like, I've diagnosed myself now. That is what it is, guys. I know what it is. It made me feel better. By 10 o'clock that evening, I was downstairs making myself dinner. I was happy out. I had no pain in my head. I was not feeling sick or anything anymore. I felt like a new woman. It was great. I didn't think anything of it then. On the 22nd then, it was my birthday, and I went home, and I remember feeling really dizzy and maybe like I was just losing my sense a bit. Yeah, I just felt like I didn't really know where I was all the time, if that makes sense. I don't know if that's, yeah.
Like
so,
a confusion.
Yeah, it was really like that. So yeah, I went home that day. Yeah, I felt that way all day until I got back home that night. That was fine. And then I sat my fiance down 2 days later, and I told him that I needed to admit myself to hospital because I was seeing people.
Okay.
And I was seeing shadows, and there was people constantly following me in my vision here and here. And I suffer with anxiety already, so it wasn't really mixed. So yeah, I did have a serious conversation with him about it, and he thought I was joking, but I was deadly serious, you know. And I kind of tried to make it into a laughing situation then, where I was kind of like, oh yeah, no, maybe I'm overreacting here a little bit. I wasn't sure.
It must have been terrifying, though.
Yeah, well, like it wasn't at the time because I really thought nothing of it. Like at the time, it was kind of like, oh, maybe my anxiety is getting the better of me, and maybe I'm seeing these shadows because, you know, my brain is thinking that I'm seeing them all. I didn't know what I made of it, but I just knew that, you know, if it kept happening, I was going to have to admit myself into a psychiatric unit because I was losing the plot. I was losing my senses, and I was just becoming more and more confused about things.
Okay.
So that was around the 24th of July. And then the 28th of July, I went home for my uncle's 50th. And it was just, you know, immediate family in his house, just at a barbecue. It was fine. I remember speaking to my nanny, and I remember feeling all of a sudden just this massive headache. It just came over me just like the click of a finger. Oh my God. And I just had to run upstairs and lie down on my cousin's bed and be in a dark room, close the curtains. I had to take paracetamol. I felt sick. I didn't know what was going on. I was trying so hard to go back down and enjoy myself, but every time I sat up or got up, I had to lie back down because the pain was excruciating. Eventually the paracetamol did kick in, I'd say about an hour later, and it kind of flattened the headache. I wouldn't say it got rid of it, but it did flatten the initial hardness. I don't even know how to describe it. It was awful. I went back downstairs then, and that was fine. You know, I thought that maybe I got a really bad headache from the sugar or something like that, cake. I didn't know. You know, people get headaches all the time. I particularly was a little bit more. I did used to suffer with headaches a lot anyway, so I just kind of thought it was something.
You had seen so many doctors. I suppose you were kind of. You felt like they'd look at you. Am I imagining this? What am I getting this from? Because you had been checked. You'd had an MRI. You know, you think you had done everything right. You've seen the dentist, everything. So it's kind of understandable, the confusion.
Yeah, it was crazy. But that night, like, I remember the headache it didn't leave. I did go home early and go to bed, and then I got up the next day. You know, the way you kind of have a headache and you think, you know, oh, this will be gone tomorrow. I just need to sleep it off or drink loads of water and hydrate. The next day I woke up, you know, as soon as I stood up, it was there. It was like a weight on my brain. That's how it felt that day. I didn't know what was going on. So I took more paracetamol. I took a Vimovo as well, which was just I thought something was inflamed. I didn't know. I thought it was my ear as well. So yeah, I kind of spent that day napping the whole day on the couch. I wasn't really able to sit up for long. I was going to sleep, and I just had to rest my eyes from the sunlight, or I couldn't go to the shop because the lights in there were just making me feel sick and just really making my head hurt. So I did kind of what anybody would do if they had a headache, which is just rest. That's all I thought it was at the time. So I rested for the day, and Dad dropped me back up to Keith then that evening. And then I hadn't really eaten much that day because I did feel sick with the headache. So we ended up getting a Chinese that night, which was lovely. But at 2 a.m. then it all came back up. So I woke up with a sudden urge of nausea, and I just went up and got sick straight away. I remember lying on the bathroom floor that night, just thinking I was going to die. I had like excruciating headache. I can't even think of a better word to describe it, but the headache was just awful.
The worst you've ever.
It was the worst I've ever had. Yeah, absolutely. But yeah, so I had that. I was lying on the floor just thinking I was going to die. I felt my heart rate going so fast. I wasn't able to keep down water or anything like that at that stage. I went back into bed and I tried to go back to sleep, and I went in and got sick again. And I thought maybe, God, I've eaten something funny from the Chinese. Like maybe, you know, I don't know what's going on in my body, like, but maybe it's just not well at the minute. Like maybe it's just a bug. But I couldn't get over the headache. And for me, I would have always been the person who would need to have been reminded to drink water. So I, you know, like I went and I drank some water, and every time I drank water, it ended up coming back up. And then it started happening with paracetamol I was taking. I can't take ibuprofen or anything like that because I have asthma. So it was just paracetamol that I was
left. You couldn't keep anything down?
Anything at all.
Did you at any stage during the night think, I better call an ambulance?
No.
No.
Not at that stage.
Okay.
Because I don't like to panic other people when I'm not well.
Okay.
It makes no sense, but yeah, so the next morning anyway, we woke up and I could not leave the bed. I was in agony for the whole day. He went downstairs and made me a sandwich and brought it up. I lay on the bed with that sandwich looking at me all day, and I could not do a thing about it. I couldn't move. That was mainly the headache, but I was afraid that I was going to get sick if I moved as well. So that day I took in no water, no food, no painkillers, nothing. And then by the end of that day, I was able to have a shower, but I wasn't able to dry my hair or anything like that. I literally had to get back straight into bed after the shower. Like I just didn't know what was wrong with me. And then the next day, the 31st of July, this is the crucial day. I did call into work sick that day and the day before. And this day particularly, my manager, Claire, she had said to me, I was ringing in with migraine saying this must be a migraine. I can't stand the light. I'm vomiting, you know, it has to be a migraine. So I rang in sick with a migraine, and Claire actually said to me, have you suffered with migraines before? And I was like, no, but it must be a migraine because I have all the symptoms of it. And she was like, you know, like maybe just get it checked out for yourself, because if you've never had migraines before, you know, maybe you should just say to the doctor.
Yes.
I thought that she was just looking for a sick line or a sick note. So I kind of went with it, and I was like, okay, yeah, she's definitely looking for a sick note, so I'll call the doctor and get sorted. So I rang the doctor, and yeah, so the receptionist answered, and she said, you know, like, what do you need to speak to the doctor about? And I said, look, I have the worst headache I've ever had in my life. I am vomiting. I can't keep anything down. I am severely dehydrated at this stage. I didn't really know any of the other symptoms related. So that was kind of the main points that I said to the receptionist. And she said, okay, yeah, look, one of the doctors will ring you back within the next 2 to 3 hours. So that was fine. Within 5 minutes, I had a doctor on the phone. And I remember her exactly on the phone. She put the fear of God into me. But she said, Amy, you need to go to the hospital now. She was like, don't even focus on getting dressed right now. She said, I need you to go to the hospital now. And I was kind of like, why? And she was like, I think you have either a hemorrhage or a clot going on in your head.
Wow. Had you seen this doctor before with the headaches?
No.
No, okay.
I hadn't seen her at all. I seen her once before, I don't even know, something unrelated completely, but it was amazing. Like, she heard the symptoms and she said, you know, you need to go to the hospital right now. So I was the kind of person who was ignorant and said, you know, this is definitely not happening to me. I am only 25 years old. That's not what's going on right now. It's a migraine. So naturally, I rolled around in the bed and stayed there for another 2 hours and got comfortable. And I just tried to reassure myself, like, no, that's not what's going on. Like, it's something. Yeah, no, it's way more minor than that. And I was like, I'm just going to panic myself. So I turned around to Keith then at that stage, about two hours later, and I said, like, look, do you think I should go to the hospital, like the doctor said? And he said, well, you're off work for the day anyway, so what difference does it make if you go up and get checked out? He said at this stage, you probably do need fluids anyway. So he was like, if nothing else, you'd be getting a bit of hydration. And he said, yeah, it's no harm to just go and get checked.
And he kept really calm, obviously, because if he had panicked, you probably would have said, no, I'm not going.
Yeah, I'm just terrible for that. Like, because I like to reassure other people when I'm sick. It doesn't make sense, but I just do it. But yeah, so when he said that, I was kind of like, right, okay, I'll go, like, because I am off work sick, and if I'm in hospital, at least I'm getting sorted and, you know, figuring out what's wrong. Even if it is just a migraine, I'll know. So yeah, I went up to A&E then that day. I think I got there maybe about 10 or 11 that morning. But I went into the triage room, and the lights in the triage room, I couldn't open my eyes in that room particularly. And she noticed it straight away. She picked up on it straight away. And she was like, have you got sensitivity to light right now? And I said, yeah. And I said, God, like really badly, like it's making me feel sick. And I had to describe other symptoms to her, like, so she was checking in my eyes as well, and she noticed that in my left eye I had something called a nystagmus, which is when you look that way, my eye was kind of going like this.
Okay.
So when there was a bit of pressure on it, and it wasn't going like that when I was focusing on anything, it was fine, but she picked up on that as well, which she said that it was something neurological then. But I did have, like, I was severely dehydrated. I was really nauseous. I was seeing shadows. I had a heart rate of 150 plus. I can't remember what was wrong. I don't think I had a temperature or anything like that. But I was in a bad way. And she actually picked up on that straight away. So she brought me into one of the little cubicles and immediately set me up on an IV. She didn't even wait for a doctor. She set me up on an IV of, I think it was saline, anti-sickness, and paracetamol. And she had them all started straight away. So that was fine. I think then the doctor came in about 10-15 minutes later. It wasn't long. She had turned off the lights for me in the room, so I was comfortable enough. But yeah, so he came in and he was just getting a brief history, you know, asking, you know, what's going on.
Is this going on? And
you know, my initial reaction was, I am so sorry for coming to A&E with a headache. Like, I feel so embarrassed right now. I kept saying it to all the nurses. I said it to the doctor. I don't know how many people I said it to. And I'm laughing at it now because it's just so funny like that.
It's so serious when you think
serious, but I thought nothing of it. Like, I really didn't. I really didn't think that it would happen to me, you know. So yeah, I explained to him then about the bouts of sicknesses I've had, about the lump on my face, and he came over and checked it, and he was like, oh yeah, how long has that been there? And I said, it's actually been there since like last September. Like, it's been going on a while, and I've been trying to get, you know, diagnosis for it for a while. And he said, right, okay, like, you know, did they do any tests? And I said they did a CT and they did an MRI. I said, I think this headache is actually from the MRI I had on the 18th. And he was like, okay, this is over a week later, you know, that's a bit unusual. And it's a bit unusual that you would, you know, get a headache from an MRI. And then I was saying, you know, like, oh, well, I Googled it and it's possible. And he was like, don't Google anything. But, he was then saying to me, you know, right, okay, I'm going to go and have a look at the MRI results and see, because I can access them on the system. So I was kind of like, yeah, great. You know, if this is just a migraine, at least I'm getting the results of everything all in one go. I was thinking, you know, positive.
And I'll get some pain relief and I'll get some fluids.
I never felt better. No, my mom and dad then, they decided that they were going to come up to the hospital because they kind of thought, you know, something is going on here. It's been too long without a diagnosis. She's been in and out of hospitals so much. There's something else going on. So they came to the hospital, and when they got there, the doctor was taking me in for my CT scan. So he really was, you know, on the ball about doing things. He was really, really fast at getting stuff done. So he took me for my first CT scan, and that was fine. The doctor told me, you know, the results will be back within an hour or two. That was fine. 20 minutes later, he came running out. I've never seen a doctor run like that. But he came running out and he asked me to come into a room with him. And he said I could bring a family member if I wanted, because he needed to talk to me. So that was fine. Mum, you know, just she got up straight away and came with me. And he took me into a private room and closed the door and locked it. And I was kind of like, what is going on? And yeah, so he sat there and he told me, you know, you have at least one blood clot, we think, in your brain. And at that stage, I kind of turned around to Mum, you know, like the look to see, okay, what way is she reacting? Because whatever way she's reacting, I'll know, like,
is it serious or not?
Yeah. So like, I'm 25 years old, I'm relying on my mum's, but she knows what I'm like with anxiety and stuff. So yeah, she kept her cool and she was just kind of like, okay, yeah, okay. So I was kind of like, right, this can't be that serious. And at that stage, to be honest, I couldn't tell you how serious the clot was. I was not able to tell you where they presented, legs, chest, anything like that. I was not able to tell you anything about them. So I was completely basing it off my mom's reaction. So that was fine. The doctor told me we do need to do a CT with contrast to clarify and to make sure that we know exactly how many clots there is. So he said, so I'm going to get you hooked up for the IV for the contrast now, and then I'm going to send you straight in. So I was kind of like, yeah, no bother. I wasn't worried or anything like that at that stage. So he brought me into the nursing station then to put the needle into my hand himself. And I remember him, he was shaking, he was nervous. And I got nervous then from him, but yeah, so he was trying to put the needle into my hand, and he put the needle in twice and it didn't draw any blood. So he took it out, and I remember my whole hand being wrapped in sellotape because he was trying to stop the bleeding quick. And he just panicked. He needed to get the contrast done. So yeah, he put a needle into my hand then, and we went in for the CT scan with the contrast. So that was fine. And then 20 minutes later, he came out and he took me into a room myself with my mom and dad and all of my belongings and everything. And he told us, yeah, this is a sinus venous thrombosis, a transverse sinus venous thrombosis. So I wasn't sure how I felt about it. I was kind of like, okay, yeah, no, this is okay. Like, and the only thing I remember asking him, because I would be the kind of person, just give it to me black and white, you know, if there's a medical condition. I remember turning around to him and asking him, am I going to die? And he was like, no, you're not going to die. And I said, well, that's grand. Like, I was like, as long as I'm not going to die, I don't care what it is.
You can get through whatever, as long as you're not going to die.
Yeah. And he, like, so he was there to reassure me, and he was lovely. So then obviously we rang Keith to come up to the hospital and his mom and stuff like that. So yeah, everybody was there. Everybody was a little bit, you know, like.
Were you relieved, Amy? Were you relieved once you knew what was going on?
Yeah, like, I mean, I was here. This was part of something. So sorry, actually, I missed that part altogether, but he came back in and told me that the CT or the MRI scan that I had done, basically, it wasn't a lipoma, but all of the muscle on this side of my face had died, and this side had over exaggerated, so it was double the size basically. So it was muscle, it was tissue, and he showed me the CT scan as well, so that I could understand exactly what was going on, which was great for me because I love to be able to see things and understand it better. So yeah, he showed me that and explained it to me really well, and it was at that stage then that he did the CT scan. I actually completely forgot about that point. But yeah, so when I was sitting in the bed then, I had another doctor come in and take, you know, a history of me of symptoms, you know, weird things. And then I remember her asking, you know, have you been seeing shadows or have you been having hallucinations? And I instantly was like, oh my God, yes. I was like, this is something. And I was so excited because I was like,
well, not mad.
Yeah, I was like, this is brilliant. So yeah, me and Keith, we were, obviously a little bit upset because we had missed, you know, a symptom, but we weren't looking out for anything. You know, we didn't think that, you know, would happen to someone our age. So yeah, that was fine. I remember then sitting in the bed, and I was sitting kind of outside the nurses' station in A&E. They were debating whether or not to send me to a different hospital that had a larger neurology centre in it and stuff like that. I was initially I was kept in the hospital I was in anyway, which was great. But I do remember the nurses walking by my cubicle and saying, "Oh my God, the girl with the clot in her brain," and the girl with the, you know, the I was baffled. I was like, "Is this like a big thing?"
Yeah.
And I remember one of the nurses specifically coming into me and telling me that it was an older nurse, and she was like, "I've never met anybody with this condition before," and asking me how I was feeling, and I was like, "Yeah, I'm okay. Like I just have like the worst headache ever. Like it was really bad. Like so all the lights were turned off and everything like that, which was."
Did they keep you in for long in that hospital?
So when I was initially admitted, I was up on a ward like within, I'd say, 6 hours from when I went into A&E, which was great. But yeah, I went up to the ward, and the doctors came around the next morning, and the first thing that I noticed was that they kept saying, you know, "We hope this will dissolve," and stuff like that, and it kind of scared me a little bit.
Because it was there for quite a while, you see. It was
Yeah.
there for a while. So what was your treatment? How did they go about treating you?
Yeah, so I was initially, like nearly straight away, I was on Clexane injections. I was on them twice a day, once in the morning, once at the night time. I was on Clexane for 14 days, and I was on Warfarin then from the 9th day as well. But they had to keep me on the Clexane until the Warfarin obviously regulated. But yeah, so that was the treatment then. But yeah, they didn't
So you've
do
been on Warfarin now for 3 years. How do you find that?
2.5 years. Yeah, no, it's like, it is a drug that has very little side effects, which is great. But at the same time, when you look at stuff, you know, online and you see what can happen, and you know,
Yeah,
like
to be Googling.
yeah, well, I shouldn't Google, I do, but I am constantly worried if I, you know, bump my head getting out of the car, or you know, stuff like that, or if I'm bending down too long and I feel a rush to my head, I'm like, oh, you know, relax. You know, it's because I know that it is very easy to bleed on warfarin, and those are the complications with the drug. Although it is helping me now, like, you know, I do have doctors who are talking about maybe taking me off warfarin in the near future. So it's just when all of the tests that you're doing can get completed and stuff like that, and they have.
How does that make you feel?
Nervous. As I said to him on the phone, he was like, "What? Like, how do you feel about me saying that?" And I was like, "Nervous. Like, you know, it's a huge thing when you're put on something that is potentially saving your life or making the risk of something that has already happened 0%. Like, you don't want to come off it. You don't want to be away from it. It's like a safety blanket."
Yeah, I agree with you. So tell me, are you left with any residual side effects after your CVST?
Yeah, so I was diagnosed with intracranial hypertension in March 2019. So that was, I was having these really crazy headaches. I had pulsating in my ear, which was pulsating tinnitus. Yeah, no, like if I laugh or sneeze or cough or anything like that, I will get an intense headache.
Okay.
And it was driving me crazy. I was like, my favorite thing to do is laugh, and I can't do it anymore. And I was like, I need something to be done. I was like, this is my only cure. Like, my only cure is laughing, and I'm finding it really hard at the minute. So he actually said to me, like, God, that is, you know, I can't remember what he said, but he was just saying like that is morbid existence. Yeah.
Yeah.
So yeah, he got me in to do a lumbar puncture then nearly straight away, and yeah, he put me on these tablets. I can't even remember what they're called, but yeah, they're for epilepsy. Yeah, they are Diamox. That's what they're called. Yeah, so they're for epilepsy and for intracranial hypertension. So it basically means that from where my clot was, it has, from what I know now, from what the doctors told me, it might not be 100% right, but the clot had, where it had formed, it had hardened slightly to the vein around, but it was getting blood flow through it. So the majority of it had gone, but there was a little bit of residue. And from that then, something to do with your veins. So your cerebral fluid, your spinal fluid goes up to your brain to protect it. Mine wasn't draining properly, or isn't draining properly, I should say. So that is essentially intracranial hypertension. it can happen to a lot of people who have CVST as well, which is what I'm told. But you know, as Michelle was saying, like there isn't a lot of studies or anything done like that. So even my neurologist was saying, like, you know, I think I'm the second person he has ever met with CVST. So it's, you know, it's hard to tell what's normal and what's not.
It's really unusual. It's unusual, yet we do hear of it. I'm hearing of it. I'm hearing it more and more, and I think we definitely need to pull together. I think you as a group should pull together and let's see if we can push towards improving information and some research about this condition.
Yeah.
No. Thank you so much for sharing, Amy. That, like, it's an amazing. How are you doing now? I mean, you know, 2.5 years on, how are you managing? Are you learning to live with?
Yeah, I mean, you have to learn to live with it. Like, I mean, my life has changed, absolutely, yeah. But you need to make a life out of what you have as well. So it's important to, you know, like, I feel sorry for myself sometimes, and it's okay to do that. But you need to remember to pick yourself back up and go, okay, right, I don't need to feel sorry for myself for this long. You know, I still have a life. I'm here. I'm thankful that I'm here. I've survived it, which is amazing. As Michelle was saying, there was a 3.4% mortality rate. I was actually surprised to hear that myself. So yeah, no, I'm happy to be here, and I'm trying to make do with what I have. Like, I do have headaches a lot, which is hard. And you know, my neurologist he's referring me now to a headache specialist to see if there's anything that can be done there.
I suppose to look at your triggers and then to see what you can do to be proactive to try and prevent them, and then how to deal with them. You're an absolute tonic. You really are, and you know, you're a breath of fresh air. Thank you so much for sharing. You really are. Stay on the line for a second. I'm just going to end the call. But we really appreciate you sharing it so honestly, your experience. Thank you so much, Amy.
No problem. Thank you.